Good morning, Terry Kuti, and we are back this morning talking with two wonderful plastic surgeons out of Charleston, South Carolina at the Center for Natural Breast Reconstruction, Dr. James Craigie and Richard Kline. I want to welcome both of you back to the program. We are the Deep Sea Foundation educational channel where we talk about all options and topics related to breast reconstruction. The term "it takes a village" has to do with our topic this morning, because in a microsurgical breast reconstruction or an implant-based reconstruction, any type that you guys have a team. Part of that team are physician's assistants. I'd like for you to tell us the integral part that they play in this process. I remember my own physician's assistants and talking to them. I'm going to let you guys tell us how important their role is.
Thanks. Right now we have 2 PAs and 1 nurse practitioner, and they function interchangeably. Mm-hmm. And for many, many years, we did this without mid-level providers. No PAs and no nurse practitioners, whereas now our entire support staff is mid-level practitioners. And in a nutshell, I would say they have allowed us to take it to the next level. And you have to understand, to get into PA school or nurse practitioner school, you really need the same grades you need to get into medical school. These are smart people. For whatever reason, they chose to go into this field. And before I went into private practice, I spent 6.5 years as a full-time academic surgeon. First at LSU New Orleans. I was on the faculty with Dr. Allen there. And then 3 years here at MUSC. And I have trained a lot of residents, a whole lot of residents in microsurgery. And I like working with the PAs even more, because they don't spend 3 months with us or a year with us. They're here for years, and they learn exactly how we like to do things. And I'll let James talk for a little bit, but I feel passionately that they have allowed us to up our game.
Definitely. We've been doing this now for 17 years, and part of the advantage of doing it as being partners is that we've had a chance to kind of tweak things and to do different ways and try to get the best team together. And so we thought it was important that we would have our own PAs for that same reason, that we would have continuity. They are with us when we see the patients before surgery. They are there when they have a follow-up. They're there when they are seen in the hospital. And so there's a lot of continuity. As well, when we're in surgery, as surgeons, we want to not ever be multitasking. And the type of surgery that this breast reconstruction, microsurgery, there are really literally hundreds of critical elements that have to be executed just right. And so to have the PAs there to do what they're capable of doing, for instance, closing an incision, allows Dr. Kline and I to focus on the critically important things. And so there's no reason that a PA can't help move a surgery along by closing an incision. That's something that they're absolutely qualified to do and have been taught to do by us. So we feel like it makes us more efficient in surgery, and we could arrange things and have a different team if we wanted, but that's the way we by far choose to do it and prefer to do it.
Right, and it's not like we turned them loose to do the entire operation. But I'm going to tell you pretty confidently that by the time one of our PAs has closed 400 abdomens in a DIEP donor site, they pretty much got the hang of it. And in all honesty, they probably do it as quickly as we do, and probably sometimes do it better than we do. And I'm totally comfortable having them do that. It allows us to increase our work capacity, and very importantly, it allows us to get the patient out of the operating room more quickly. And most of the surgeries we do, for whatever reason, are simultaneous bilateral reconstructions. So it's harvesting 2 flaps, doing 2 at once. We would never in a million years dream of just doing one side. And PAs allow us to do it quickly, reproducibly, with a very high success rate, and get the patient out of the operating room, hopefully early to mid-afternoon. And we absolutely could not do it without the help, and we're glad to have it.
I am so glad we talked about this. I'm going to make an analogy, and then I'm going to hone in on a word that I believe I heard both of you use. You can go to a beautiful concert where there is, you know, a world-renowned, high-class, successful orchestra. You can hear a celloist. They might sound wonderful. They're extremely skilled, beautiful music. However, when the whole orchestra comes into play, here's the word you used, it enhances it. It enhances time, the ability for you guys to get the best results you can. I want viewers to know I have so much respect for PAs, and I wanted them to hear this video today. They are part of the well-orchestrated team of microsurgery and breast reconstruction.
And I would also add what might not be immediately apparent thinking about this is that if the PAs play an integral part in the intraoperative portion of the care, they know exactly what goes on in there. It lets them do a much better job with the preoperative evaluation and postoperatively handling any problems. And that doesn't mean they're trying to handle it by themselves. It simply means they know what's going on. And there's going to be plenty of times when you've had your surgery, you call the office, you may have a simple question, you may have a hard surgery. Guess what? The surgeons are all in surgery. But if you can get a PA who may have even been there during your surgery, 99 times out of 100, you're going to get some very meaningful input and have your problem answered. So yeah, we feel very strongly they're absolutely part of our team. We hope the ones we've got stay here forever because they've all been broken in. They know exactly what they're doing. We currently do between 150 and 200 perforator flaps a year. We're almost up to 2,000 flaps. And there's no way, I might add, with a DIEP success rate of 99.01%. There's absolutely no way we could keep this pace up with these results without our PAs. And I don't think any place could.
And I'll also add that, when we see our patients, I tell them what, they meet the PA and they meet me and we're planning for surgery the next day. I explain to them exactly who is going to be doing what and how we do it so that they understand that it's not something that I'm trying to hide, or we gladly explain that to them in advance, and it works great.
Yeah, and it's not just plastic surgeons. I mean, PAs play an integral role with spinal surgery, orthopedic surgery, cardiac surgery. They're just part of the operative team in the best teams now, and it's been that way for some time. So they're just a plus.
And nurse practitioners.
And nurse practitioner. I use nurse practitioner and PA interchangeably because while they get there through different ways, they're basically licensed to do the same things.
Yeah. I'm so glad we had this conversation, and really to honor this group of medical professionals and to let patients know what an integral part of the team they are in breast reconstruction. Thank you guys both for being on the program again today.
Thank you.
You're very welcome.
Yeah. If you guys have any questions or comments about this video, please put it in the comments after viewing, and let us know if you have any other topics you would like us to cover. These two stepped out of clinic quick to record this video today, so these doctors are so cooperative and so good at helping educate others about breast reconstruction. You guys stay safe, and we'll see you soon.
Thank you, Gary. You too.
All right, take care.